Good morning, everybody. We are live on YouTube now. Welcome to this online CME series being conducted by the Kerala Society of Ophthalmic Surgeons. This is the 11th in the series, and it's a very special series being presented by our own president, Dr. Meena Chakrabarti, on a very, very important topic, mask. I feel the mask is the mother of all PPE. If we neglect the mask and put on all PPE from head to foot, it's of no use. So Madam is going to deal with it in detail. You can all come forward, ask questions, and clear all your doubts on masks so that it's going to help us as well as the paramedical staff and the public at large. And now I request Dr. Mahesh to formally introduce a madam, as this YouTube coverage goes all over the world. So I want Mahesh to unmute and introduce madam to the audience.
Thank you, Rajiv. I have great pleasure in introducing madam, even though it doesn't require any, she doesn't require any intervention, introduction. Madam has done her initial medical training in Trivandrum. After that, she did fellowship in Vitretina in Aravind Hospital and worked as a consultant there, and came back in the mid-90s to Trivandrum and started Chakrabarti Eye Care Center. Literally almost 25 years now. She has been active in the academic forefront of Kerala Society of Ophthalmic Surgeons in the last 20-25 years. She was the chairperson of scientific committee. Every year she will conduct continuing medical education program, instruction courses, and PG training programs. And she said she also conducts instruction courses in Indian All India Ophthalmological Society as well as American Academy of Ophthalmology. So no other, you don't need any other words to describe madam, and I request madam to start, hand over to madam.
Is my screen visible, Rajiv?
Screen is visible, madam, but not your presentation. A presentation edit. Yes, madam. Full screen. Yes, madam.
First of all, good morning to everyone. My respected teachers, my seniors, dear friends, and my young colleagues. I have chosen to speak on a topic which is very close to my heart, because I have done a lot of investigation on this for my own center. When we tried to purchase masks, there was so much that was left unsaid, so many queries that could not be answered. So this is the result of all that. And I've titled my presentation as Hung from a Mask, because it looks as if the mask had turned out to be the mother of all PPE, and our life hangs from the kind of mask that we are going to use. So before I go into the subject, let us not forget that the other disciplines are to be strictly followed, especially the hand hygiene with soap and water, which is the best of all the disciplines that we should follow. Social distancing, use of mask, and in India using the Arogya Setu app. And we ourselves should have the discipline to follow each and every one of this. So why this lecture on maskology? I've already explained that the mask is the last line of defense in the hierarchy of control. It seems as if our life hangs from a mask, and it is working 24/7, protecting people, protecting lives. And in the course of this presentation, I'll basically deal with the types of masks that are available, what type of mask is suitable for a particular type of a healthcare worker, and how the filtration occurs in a mask, the basic structure of the various kinds of masks, the difference between the different types of masks that are available, and then go on to the very important frequently asked questions on the decontamination of the N95 mask. So if you look at this decision tree, the eye care worker, in contrast to the healthcare worker, deals with a particular kind of patients. Our exposure to the patient, our contact to the patient is definitely there, but to a lesser extent than a frontline COVID worker. So I have basically divided the people working in an eye care center into 4 levels. The level 0 is the office staff who does not require any specified protection, special protection in the form of an N95 mask. They can wear a cloth mask or a procedure mask. The level 1 is a COVID screening desk, the security, storekeeper, pharmacy, billing, cleaning staff, and the optical staff, for whom usually a 3-ply mask, a face shield, and autoclavable lattice gloves are given. The level 2 is the staff who are in contact with the patient, but a little in the periphery, not actually in contact with the patient. The nursing staff, the facilitators, and the counselors, who will be given again a 3-ply mask, or if they're in actual contact with the patient during counseling, a N95 mask and the face shield. And then comes to the prime workers, the ophthalmologist, the anesthetist, the nursing staff assisting the doctor, who requires an N95 mask, a face shield in front of that, as well as gloves. So what happens? Why do we need a mask? When a patient coughs or sneezes, he actually expels out 2 kinds of particles. The first one is the large spray droplets, which are greater than 0.1 millimeter in size. They are heavy and they are usually coated with the patient's mucus or saliva. Since they are heavy, they fall down. They do not travel for a long distance and they settle down on surfaces, especially on the fomites. That is why the fomites require cleaning every 2 hourly. The second set of particles that are released are the aerosolized viral particles, which stay in the air for a longer period of time. These aerosolized viral particles are less than 10 micron in size. There is a very elegant study which looked at how long the virus remains viable in the aerosols that are released by the patient. And the study showed that it remains viable for a period of 3 hours after the patient has had an episode of coughing or sneezing or an aerosol generating procedure that's taken by the patient. It also looked at how long the virus survived, if it fell on a fomite, plastic, steel, cardboard, and these are the various. The maximum is up to 72 hours the virus is viable. So these are the different kinds of masks. As I go through my presentation, I will try to elaborate on each one of them, especially the filtering face-piece respirator, the FFR, where we are directly using the filter on our face over our nose and mouth. The medical mask, what is the difference between a medical and a surgical mask, whether it is the 3-ply mask or the FFR. And then the higher end category, the elastomeric mask and the powered air respirators. So let us look at the size of the coronavirus. The coronavirus is about, the viral particle is about 0.06 to 0.14 micron in size. And respirators, the blanket statement which states that the respirator with a high efficiency can actually filter the 0.1 micron corona particle, and any respirator which can filter up to 0.3 micron can filter even lower size particles. Why is it so? Let us look at it. This is a comparison of the various particles. The coronavirus is about 0.1 micron, and why this focus on 0.3 micron is that 0.3 micron is the most penetrating particle size, otherwise called MPPS. Up to 0.3 micron in size, the particle moves in a way that we anticipate. It moves in a straight line, comes through the filtering part of our mask, and if the size of the filter is smaller than the size of the viral particle, the viron gets trapped there and we do not inhale it. So what happens if we have a particle size which is less than 0.3 micron? For example, the coronavirus size is only 0.1 micron. In a particle with a small mass, such as the coronavirus particle, exhibits the Brownian movement. If you recollect our physics that we learned in school, when a particle has a very low mass, it does not travel the way we anticipate. It moves in a zigzag manner, collides with the nitrogen and oxygen molecules in the air, it pinballs it further. So when the viron reaches our mask, it is actually moving in a zigzag manner and it usually impinges on the fibers of the melt-blown layer of the mask, that is, which is the filter of the mask. And even if the pore of the mask is larger than the size of the viron, usually its motion is impeded and it gets trapped on the surface. So the filter of the mask acts like a kind of a fishnet and it traps the viron. That is why the emphasis is on 0.3 micron, and any mask which can filter a particle up to 0.3 micron can actually filter particles which are lower, smaller in size, which exhibit a Brownian movement. So this is another elegant study which looked at 6 models of the N95 respirator and tested it for its efficiency. This efficiency is known as the particle filtration efficiency, in contrast to the bacterial filtration efficiency, which is again has to be tested, and found that they work elegantly and is able to filter about 94% of all the particles with size lower than 0.3 micron. So next is a big question, the answer which all of us would like to hear: whether a surgical mask, the usual surgical mask that we used to use in the theater, is equivalent to the N95 FFR. The blanket answer is no. It has been shown that although in lab settings under artificial conditions, the surgical mask blocks up to 80%, mark the 80% of all particles down to 0.007 micron, compared to the particle filtration efficiency of an N95 mask, it's about 95%. There is no confirmatory clinical study to show that the surgical mask is equivalent to an N95 mask, whether there is a variety of studies showing that the particle filtration efficiency of the N95 is about 95% in filtering particles lower than 0.3 micron. If you look, there are very few studies of the coronavirus because it is a new disease that is emerging. But if you want a comparison, you can compare to studies on the influenza virus, which has almost a similar size. And there are 2 studies, one coming from the US and another from Canada, on healthcare personnel who were divided into 2 groups, and one group wore the surgical mask and the other group wore the N95 mask. And this was a study which showed that the surgical mask was non-inferior. It is left to us to look at how such a result could have been obtained. But wearing a mask is anyway better than not wearing a mask. We are not dealing with the influenza virus pandemic. We are dealing with a more vicious kind of pandemic. And hence, whether this statement will stand water is left to us to decide. So if you look at the filtration efficiency of the mask, this is what the mask is tested for. A standard procedure single-use mask is tested for a 3 micron particle filtration, which is about 95%. The surgical masks are tested for a 3 micron filtration particle, and most of them are not tested for anything less than 3 micron, while the N95 is tested for about 0.3 micron filtration. If you look at the structure of the surg mask, you will be able to understand why the N95 is able to filter better than a surgical mask. A 3-ply surgical mask ideally has 3 layers. It has 2 layers of non-woven fabric. Here the fabric is a polypropylene sheet, thin polypropylene sheet, which sandwiches a melt-blown layer of again a plastic, and this melt-blown layer is the filter. The size of the filter varies from mask to mask. So when you're purchasing a 3-ply mask, see to it that you have a melt-blown layer in between. I've given the example of a mask when cut open did not have a melt-blown layer. It had just a tissue paper inserted in between. On the other hand, when you look at an N95 mask, it is a 5-layered mask. It has 2 layers of melt-blown sandwich between the spun or the non-woven fabric, and hence it is able to filter more particles. There are also carbon impregnated filters which can be used instead of melt-blown, and this is also there's a lot of work being done on this, and maybe in near future before the pandemic ends, we'll be able to use carbon impregnated masks. So we have an N95 mask which actually seals our face. There is very little leakage from the sides. An ideal N95 fit should have very little leakage from around the face, and it filters out 95% of the airborne particles, and hence I'm sure it's clear to all of us why an N95 respirator is able to do a much better work than a surgical respirator. However, in the face of an epidemic where there is gross N95 mask shortage, we do not get the new certified mask in our country now. The 3M agency is no longer selling that kind of mask to us. And in such a situation, we may have to use a 3-ply surgical mask, it actually does some work. It's able to give us about 80% protection compared to the 95% protection that N95 is able to give. So if you look at any mask in general, a mask has 3 levels of performance: level 1, level 2, and level 3. And in all these levels, the mask is tested for a few factors: particle filtering efficiency, which is PFE, the bacterial filtering efficiency, the delta P is the differential pressure on either side of the mask, and whether it's a flammable mask or not, especially when you're using a surgical mask in theater setting and you're using a bipolar cautery or a monopolar cautery. In addition, the level difference also depends upon whether a mask is fluid resistant or not, especially to the splash of blood. And depending upon the fluid resistance, the value 80 is the 80 millimeter mercury force of blood splash on the surface of the mask, and 120 and 160. This is for general surgery, not for ophthalmology, when they cut an artery during surgical procedure and there is a splay of blood on the surface of the mask. The mask should protect the surgeon. It should not get wet and the blood should not go into the surgeon's mouth. So that is the idea of testing the fluid resistance. In our country, the standards for testing is not the NEOR certification. It is the BIS, the Bureau of Indian Standards, and ASTM, which is the American Society of Textile Manufacturing. We have an equivalent agency in our country which is called CITRA, that is South Indian Textile Manufacturers Association, which has a lab of excellence which looks at the fluid resistance of various medical fabrics. So that is the standardization criteria in our country. So let me explain the few basic common abbreviations that I use. PPE, we all know, it haunts us in our dreams also. FFR is...
Madam, excuse me, madam. Window on the close here, madam. Breeze in the shabdam. A lot of...
Sorry.
Okay, madam. Now it's okay.
PPE is something all of us know. It has been troubling us in our dreams also. FFR is the filtering face piece respirator. N95, I've already explained. CDC is the Center for Disease Control and Prevention. And NIOSH, NIOSH is the National Institute of Occupational Safety and Health, which is a certification unit, a branch of CDC for all personal protection equipment in the US. The respirator standard is judged by its particle filtering efficiency, the ability to remove dash percentage of particles which are less than 0.3 microns in diameter, and N95 I've already explained means that it is able to filter 95%. FFP1, FFP2 are corresponding respirators from the European countries. P3 is the standard in Australia and New Zealand. So NIOSH has basically classified the FFRs into N, R, and P. You should not get confused when you're purchasing a mask. N stands for not resistant to oil mist. R stands for resistance to oil mist, that is the oil-coated aerosols, especially in industry when there's a fire and there's a lot of oil-coated aerosols in the atmosphere. And P resistant to an oil-proof structure where it's able to resist oil-coated aerosols for more than 8 hours. And each of this N, R, and P has a filtration efficiency of 95, 99, or 100. And N95 will filter 95%, 99 and 100 will also have a higher filtration efficiency and not actually needed in the present pandemic situation. So when you're buying a mask, should you buy a surgical or a non-surgical medical respirator? The difference between a surgical and a non-surgical or a medical respirator is only in the fluid resistance. The particle filtration efficiency, the bacterial filtering efficiency, the flammability, the delta P differential are all the same in all the 3 types of mask. If you look at 3 types of 3M masks, the 8210, which is a commonly used during the COVID pandemic, 1860 is a surgical mask and 1870 is also a surgical mask. The 1860 and 1870 have a higher fluid resistance. That means it is able to withstand the splay of fluid. I've already explained that our standard in India is a CITRA, the South Indian Textile Research Association. And some of the masks, especially coming out now from India, there is one coming out from the Indian Institute of Technology from Delhi, which is CITRA certified. Now we come to another important piece of information, the difference between the use of a valved and a non-valve respirators. We have seen patients coming into an OP with very stylish valve respirator. A valve respirator makes it easier for the person, the wearer, to exhale. It is very comfortable to use. There is very little carbon dioxide buildup inside. but it is a one-way filter. It does not filter the wearer's exhalation. It protects the wearer, but it does not protect the people surrounding him. And hence, hospital and other medical practices do not advocate use of valve respirator. One hack that we can use in our OP, if we have a patient walking in with a classy looking valve respirator, is to have him wear a surgical mask or a cloth mask to cover the valve so that we are protected. So let us look at the other differences between surgical mask and N95 respirator. This has all been tested, but in addition to it, there are two testings which are very important. One is a user seal test, which has to be done each and every time you wear an N95 mask. You wash your hands with soap and water, wear a disposable glove. You cup the respirator in your hand, place it over your mouth, and then put the straps, one over the top of your head and the other just below your ear. And then you do the positive and negative phase user seal test. That's by inhaling and exhaling, and see to it whether there is any leak. Before you do that, using both your fingers, not a single finger, and pinching on the nose piece is not right. Use both your fingers and gently smoothen out the nose piece or the fit enhancement at the nose over your nose so that there is a tight fit. This has to be done each time you put on your N95 respirator, which is not necessary for a surgical mask. In addition to it, there's a fit test in which all the healthcare employees should have undergone, but now the fit test kit is out of supply. It's quite expensive. In the US, it costs around $611, and you don't get it free when you buy the mask. And hence, we have to resort to using the face seal each time we use the N95 respirator. There is very little leakage in the N95 respirator, but some amount of leakage will definitely be present, however tightly you tighten your mask. And the test for efficiency, in addition to being tested for the particle filtration efficiency, the bacterial filtration efficiency, fluid resistance, delta P and flammability, the N95 is also tested for a filter efficiency test by NIOSH, which is a special test. So you are safer in using the N95. So how does it compare with the homemade do-it-yourself mask? If you open the YouTube and see, you can see innumerable videos on do-it-yourself mask. Even a disposable cup has been used as a mask. And people just stitch a pocket to match their dress, and they put in either a tissue paper inside. Some people use the vacuum bag of a vacuum cleaner, which is actually a very good filter, but it will not allow the person to breathe smoothly. And these are the various things that people have put in between two layers of cloth and used as a mask. The homemade mask basically is recommended, but social distancing is not possible. It should be worn at home also. When you have a cough or a cold, when you're using a public transport, when you're shopping, it is designed to prevent your nasal secretion or your saliva from contaminating the atmosphere. You're actually respecting the people surrounding you, and it does not give you protection from contacting viral infection. So if you want to write an LG on the mask and title it The Mask and the Man, this is how it should be. The surgical mask says that I protect you. An N95 mask will say that I protect you. At the same time, I protect myself also. While a valve N95 mask will say that I protect only myself and I expose you to the infection. This is how the LG would be like. So let us go on to the very, very important topic, the frequently asked questions on masks. I had a lot of questions when I looked for what mask to buy for my staff. I have put all of them down in black and white. I've taken help also from a site called the Decon, which is a decontamination site. It is a CDC related site. And we look at the first question on who should be wearing the N95 filtering face piece respirator. According to the CDC guidelines, it is recommended only for use by the healthcare personnel who need protection, a frontline worker who needs protection both from airborne as well as fluid hazards such as splashes and sprays. The respirators need not be used or recommended outside the healthcare settings, and the general population can restrict themselves to using cloth masks so that the respirators don't go out of supply and the cost is not inflated. Will wearing a surgical mask, a cloth mask, or a face shield to cover the respirator prolong its life? Yes, To a certain extent, it prolongs the life of the FFR by seeing to it that there is less contamination on the surface, and the CDC guidelines, especially the emergency extended usage guidelines, says that using a cleanable face shield is preferable over an N95 respirator to reduce the surface contamination. How about a surgical mask? A surgical mask, when worn over the N95 respirator, actually interferes with the filtration of the respirator. And in addition, there's an increased cost. You're paying about anything between 8 and 16 rupees for the surgical mask. And there is also concern. A time might come when the N95 is already out of stock, the surgical mask may also go out of stock. So you can restrict yourself to wearing a cleanable face shield, which is actually a one-time investment, and you can clean it every day with an isopropyl alcohol rub at the end of your working day, and then reuse it the next day. So you can use a clean face shield on the surface of the N95 mask. Is it safe to use an expired N95 FFR? The mask that we have got so far in our country does not have an expiry date. So we are safe probably. The CDC extended guideline says that you will have to use the N95 mask when past is manufacturer designated shelf life, which is usually for a period of 5 years from the date of manufacture, and provided that you store it carefully in an uncontaminated way. But before using it, if it has crossed its expiry date, you should examine the fit enhancement nose attachments as well as the strap to see if it has degraded or not before reusing it. What FFRs can be used as an alternative to N95? You have the option of using equivalents or alternatives which offer a higher protection. For example, the elastomeric half mask, the full face piece air purifying respirators, or the powered air purifying respirators. You have the option of using other NIOSH approved disposable FFR, the N99, N100P, or R99 and 100. And in crisis, the CDC has approved the usages of respirators similar to N95 from other countries. Let us look at what these are. So these are the certification standards in different countries. India has the BIS, Bureau of Indian Standards. And the other mask manufacturer is China. Their masks come with the certification acceptable product is KN95 or KP95. So these are the standards used for certification. It's a little too much to go into. This is available if you look at the internet. It looks at the filtration capacity of the mask both during inhalation and exhalation. It also looks at very important point, the amount of carbon dioxide buildup that occurs within the mask. Most of us who wear the mask continuously, we understand at the end of the day, you feel a little irritated. You have a little headache, which is because of the hypercapnia that occurs. When we are dealing with counterfeit N95 FFRs, how can I tell whether the mask that you purchase is counterfeit or the original? Counterfeiting of N95 respirator is a known issue. If you look at the 3M website or the CDC website, you can see a lot of information on it. And NIOSH approved respirator, most of the respirators that we have here in India has NIOSH written on it. But the NIOSH symbol may not be correct. And if it's a NIOSH approved respirator, there is an approval number. And if you take the approval number that is written on the mask and look at the NIOSH certified equipment list, or go to the website and see, you can definitely know whether the manufacturer is NIOSH approved or not. So this is the original. It will have an approval number on its surface. It will have the filtration rating, that is N or P or R. NIOSH this is how the NIOSH is entered. It will have a lot number and a model number. And these are all artificial masks because the product does not, counterfeit masks because it does not have the marking on front. And these are some of the respirators which I have used in the last 3 months. Everything says that it is NIOSH. There is one, the gray one, which said that it's from 3M, but they did not have a NIOSH marking on it. We have the Dhool Raksha, the Dhool Suraksha, we have the Kavach. We have a lot of counterfeits in our country, most of which are not certified, and not, even if it's not certified by the NIOSH, it should at least be certified by the Bureau of Indian Standards and CITRA certified. There are very few of them which are certified by that also. So we are using what is best available to us. You can look at the website and see if it is a cookie cutter website, or if you're getting it from a third party. The most important question that you should ask, it's the price variation. If they are offering an N95 mask for 30 rupees, then you have to take it with a pinch of salt. Or if they are claiming that they have unlimited stock at a time and stocks are depleted with most of the vendors, then also you should take it with a pinch of salt. Next is a very important question. Is it safe to reuse N95 FFR? A question that all of us have been asking ourselves, and without pinching our conscience, limited reuse of N95 respirator during a critical shortage situation like a pandemic that we are facing right now is permitted even by the CDC. And you should discard your N95 respirator when the respirator is too difficult to breathe to. It is visibly soiled either with body fluids, contaminated on the outside, or contaminated on the inside with the makeup, lipstick, or the foundation cream that is worn, and it does not fit properly. That's a time to discard it. So we have two kinds of reuse. We have the limited reuse and the extended reuse. The limited reuse of the N95 filtering face piece respirator refers to the reuse of the same N95 mask for multiple patient encounters. It involves repeated donning and doffing, and in between the respirator should be safely stored in a container that is a breathable container, reused by the same healthcare worker and not shared by his colleagues till the FFR is functioning. The staff should be instructed and encouraged to reuse their N95 masks. This is again from the CDC site. Instead of throwing them into the trash, they should store them in breathable bags or plastic containers, and do not encourage reuse if the mask has been used during an aerosol generating procedure or it has splashed blood or body fluids on it. N95 should not be shared between users. You should prevent, when you're storing, the straps from getting contaminated with the front of the respirator, and you can maybe use a 70% isopropyl swab to wipe the mask separately each time you use it. Avoid storing the respirator in a steel plastic containers. If you are going to reuse that, it's going to stink horribly. So discard those kind of respirators. So what is the maximum possible number of safe reuses that is possible? As a blanket statement, giving a generic number of reuses for all makes of mask and all type of masks, it is not known. You have to follow the manufacturer's guidelines. And if you look at the respirators that we buy, most of them do not have manufacturer guidelines in it. So we follow the CDC's, it's easy to follow the CDC's emergency usage criteria, which says that the limited number of reuses should not exceed more than 5 reuses per device. And during reuse, you should have additional staff training. You should put up posters on the protocol the staff should follow for reuse. They should be trained on the proper donning and doffing techniques. Usually by bad technique of wearing the mask spoils the mask, and daily physical inspection of the face piece respirator is necessary each time you wear it. So what is the kind of physical daily inspection that you're looking at? You're looking at the respirator for presence of any physical damage. See whether the strap is sealed, is stretched. If the stretched strap and the strap is loose, means that the respirator will not seal your face adequately. Look at the nose piece or the fit enhancement nose device and see whether it's broken or loose. See if the surface of the respirator is contaminated or stained. See if the respirator is smelly, soiled on the inside with makeup, or is difficult to breathe. Such a respirator has to be discarded. What is the additional protocol that your staff should follow during reuse? The staff has to conduct the user seal check, which I explained initially. In between use, they have to pack and store the respirators. They have to label the name on the container on which they are storing the respirator, and you have to label your name on the strap. And meticulous hand hygiene practices has to be followed each time you don the respirator. And after donning the respirator, again, you have to wash your hand with soap and water, because your respirator can be a source of contamination, not only you, but also to the patient whom you are assisting. Then what is extended? Now we have looked at limited reuse. So what is extended use of the N95 respirator? Extended use of the N95 respirator is a practice that is preferred over limited reuse. It implies that the wearer wears the same N95 mask to conserve supplies for a period of 8 contiguous hours, which is probably the entire duration of his duty shift. And during this period of time, he has repeated close encounters with several patients. All of them are infected with the same respiratory pathogen, and his working area is in the same place. He may be posted in the ICU, or he may be posted in the ward or in the waiting area. And the maximum length of time that the person wears is not a blanket statement of 8 hours. It depends upon the hygienic environment. For example, if the patient has to move from a fairly clean area to an infected area, or from an infected area to a clean area, the respirator has to be removed. Or for practical consideration, we have to use the restroom or take a break and have something to eat, then the respirator has to be discarded. So extended use, you wear the same respirator as long as it is possible to wear, provided that you're working in hygienic conditions and your practical conditions does not necessitate that you remove the respirator to go to the restroom or take a meal break. This is preferred over reuse. And in addition to wearing the respirator, you're advised to wear a cleanable face shield also on top of it. And strict hand hygiene must be practiced. Each time you have to adjust the respirator either for comfort or to enhance its fit, and proper PPE donning and doffing techniques should be practiced by all the staff. So if you have been using the respirator, extended wear or limited reuse, how do you decontaminate? What are the respirators that you take for decontamination? Do not decontaminate a respirator which you have used for an aerosol generating procedure, for example, for sputum collection, bronchoscopy, a bronchial lavage. For that kind of procedure, if you have used the FFR, for us, it does not matter. The amount of aerosol that is there in our procedures are very minimal, unless the patient retches and vomits during fluorescein angiography. The amount of viral particles that is present in the tears is also very minimal. So even if we are contaminated, we are safe. We have chosen a safe specialty. So during extended reuse or limited reuse, does your FFR pose as a health risk for the healthcare worker or for the patient? It could be a risk because the surface of the FFR, especially the filter, acts as a kind of a fishnet. And contact transmission of the infection can occur by self-inoculation for the healthcare worker himself, or by direct or indirect contact, the patient can get contaminated. Various studies have shown that the wearer averages about 25 touches on the surface of the respirator during an 8-hour shift. Whether you want to do it or not, you actually touch your face or the respirator unknowingly. The second problem is that during reuse, there is a risk of re-aerosolization of the viral particles into the atmosphere when the healthcare worker coughs or sneezes. But this study, which I have quoted here, published in 2012 and another in 2013, shows that 99.8% of the pathogens are trapped on the surface of the respirator, and whether when you touch it or not, it does not contaminate your hand. And re-aerosolization occurs only in a very small percentage of the particles that are trapped. But still, extended use and limited reuse of the FFR poses as a healthcare risk for the healthcare worker. And the healthcare worker should follow proper hand hygiene, use of gloves, and should avoid touching the surface of the respirator. Next, we come to fit testing, which is mandatory during the influenza pandemic, the other SARS and the MERS pandemic that was there. But right now, fit testing is not done in majority of the centers. It was mandatory previously. Alternate strategies is to use the user seal check each time you use the respirator. And this is the fit testing kit, which can be purchased. It costs around $611.10. It is unavailable right now and it's shipped to us in about 2 to 3 weeks' time. So now we look at the decontamination of the N95 FFR. I've divided it into acceptable methods. Acceptable in the sense that CDC has permitted use of these decontamination measures when FFR shortage is there, supply shortage is there. These are acceptable because there is also scientific literature to support that the filtration efficiency and the shape of the respirator is retained even after decontamination. These methods are using hydrogen peroxide, either in the form of a hydrogen peroxide vapor, vaporous hydrogen peroxide, or the hydrogen peroxide gas plasma, the UV G1. All of us have tried our hands at making home do-it-yourself UV boxes, the UV G1 or the UVC, and the use of moist heat and humidity, which if there are sufficiently strong scientific studies to prove its use would be best for us, where we can just autoclave our respirators. Under evaluation but not acceptable are the dry heat, ozone, carbon dioxide, ETO, microwaving. But a word of caution that when you're decontaminating your N95 FFR, handle the decontaminated FFR carefully. And a decontaminated FFR is not to be worn by a frontline worker, a worker who is working in the level 4 COVID ICU or even the step down 2 or 3 ICUs. So you look at a decontamination procedure that preserves the particle filtration efficiency of the mask, the fit of the mask. It kills the virus and other pathogens, not only virus, but other cross-infection with hospital-acquired methicillin-resistant staph aureus can occur. And there is no hazardous residue. For example, if you're using ETO, there is hazardous residue sticking onto it. If you're using bleaching powder to bleach your mask, there is bleaching powder residue and chlorine sticking onto it. If you're using chlorine dioxide, there is chlorine residue on your mask. So hazardous residue should not be there on the mask. So washing your mask in soap, using alcohol rub on the mask, bleach immersion, gamma radiation will damage the filtration capacity. Just reusing the mask over overnight storage, using UVA or B radiation or sunlight is inadequate to deactivate the biological pathogen that is there. Taking your mask home to decontaminate it is again hazardous. You will have the risk of supplying infection to your near and dear ones. And certain precautions should be explained to all your staff members before you adopt a decontamination procedure. For the donning of the mask, they should follow strict hand hygiene practice using soap and water or use a 70% isopropyl alcohol hand rub. Wear sterile, clean, non-sterile gloves. Take the FFR in the hand and examine. Do not touch the inner side of the FFR. And don the FFR. You do the user seal check for positive and negative. And if the FFR is damaged in any way, discard it immediately. So how many times can an N95 FFR be decontaminated? It again depends upon the specific model, the decontamination method that is used, and how heavily or how roughly your N95 has been used. Between 5 to 15 doffs can be done after decontamination, but again it depends upon the physical examination result and how the fitness of the mask is. This is an important question. Can the N95 be decontaminated by just storing it without treatment? Our National Society has asked us to issue 5 masks to each of our workers. And after a day's wear, they store it in a breathable paper bag or a plastic container which has holes in it, and reuse the same mask on the 6th day. So how hygienic is this? The CDC guidelines also states that the viral particles remain viable for a period of 72 hours, that is 3 days. You're waiting for another 2 days before you're re-wearing the mask. So in all practical sense, the mask N95 would be decontaminated by the time you re-wear it. But this kind of decontamination is not to be followed by a front care health worker. There is very little published data on this kind of decontamination. Do not expect your N95 to be free of other pathogens. For example, methicillin-resistant staph or vancomycin-resistant staph aureus. Proper hand hygiene, limited reuse and discarding of N95 FFR that is damaged should be explained to all your staff members if you are doing this procedure in your hospital. This is from the decontamination site. I've given the website address. They say that you can actually store it and for a period of about 4 to 5 days and then reuse it, provided that you are storing it at room temperature and your FFR is not damaged. Now let us look at the vaporous hydrogen peroxide in hospitals which have been using hydrogen peroxide to decontaminate whole rooms, especially when which patients with the Clostridium difficile spore-forming bacteria is there. Sometimes they sterilize the room by decontaminating it with the hydrogen peroxide vapor. If a multi-specialty hospital has such a facility, they can use the same room to decontaminate their mask. where the number of masks required per day will be very high, unlike in a standalone eye care center, where the number of masks required per day will be less. So these are the various types of hydrogen peroxide that are used for decontamination. You can use the H2O2 vapor, aerosolized hydrogen peroxide, which would be an easy way of decontaminating the mask. You spray the mask with the hydrogen peroxide, aerosolized H2O2, and the hydrogen peroxide kills the pathogen, and then it gets converted to water and oxygen and vaporizes away. Vaporized H2O2 followed by ozone, ionized H2O2, H2O2 plasma, liquid H2O2 by submerging the mask in H2O2 for a period of 30 minutes. But whether this is sufficient or not, there are no tests, no scientific tests. However, vaporous H2O2, there is scientific literature to support its use. And how many times can an N95 mask that is decontaminated with using an HPV or VHP be reused? In the US, they use the Battle HPV process, which is a free process. You can label your mask and send it to them. They decontaminate about 80 lakhs masks per day. This is a kind of setup that is there. It is installed in the yard of the hospital. It is actually temporary room kind of thing, where the staff entry is restricted. Only the properly staff donning the PPE, the face shield, goggles and the face shield to protect the skin and the eye enters the room. And this is how the mask is decontaminated. The use of H2O2 is, compared to the UVC, is actually much more foolproof in that it penetrates the material of the filter material of the mask, and it destroys the biological load, while the UVC may not penetrate, especially the curvature of the mask, where there's going to be shadowing. So let us look at the next method of decontamination, the UVC. This is the Decon slide, which states that the UVC radiation is germicidal. The wavelength that we are looking at is about 254 nanometers, the UVC peak lamp wavelength. You require a dose of about 1 joule per centimeter square to inactivate the SARS-CoV-2 analog, that is to produce a greater than or equal to 3 log reduction in the Baron count. And the straps usually do not get decontaminated, so you have to disinfect the strap by wiping it with another disinfectant. The efficacy of UVC decontamination varies depending upon the model. If you're using a higher strength UVC radiation, you may damage the filter and you might also damage the strap. You also require an UV sensor to actually assess how much UV radiation goes in. And you should see to it that all surfaces of the mask are irradiated. So you just cannot dump the mask into the UV box and take it out as decontaminated. You should position the mask in such a way, or have the UV lamp positioned on all sides of the UV box that you're going to make, and see to it that all sides of the mask are impregnated, are irradiated. And the total dosage should not exceed 300 joules. This is how it should be. All surfaces should be irradiated. And you should choose a lamp which does not produce ozone, and see to it that the lamp is there on all surfaces of the box that you're making. And actually bake the box yourself. When a cardboard box is sufficient, you coat the inside with the aluminum foil, and then have a kind of device, a stand, so that the mask can sit comfortably, and have the UV lamps on all sides, so that all surfaces of the mask are irradiated, and shadowing effect is not there. The straps have to be, some shadowing occurs under the strap, and the strap has to be decontaminated. And how many times can you do this? Up to 10 cycles, if you are donning and doffing in a proper way, and the strap does not degenerate, can be done. And UV radiation, should also bear in mind that the UV radiation is harmful to the eyes and skin, and proper precaution filter should be worn before the box is opened. You can have, this is an example of an UV box, and this is the example of a mask stand. Can be used. You can actually purchase the sensor for anything between 5,000 to 9,000 rupees. The box you can make on your own. The UV lamp, the fish tank UV lamp can be used. It is UVC radiation. See to it that it gives a UV dose of 1 joule per centimeter square, and you can use it. Have a sensor outside to see how much UV radiation goes into the FFR, and also have a timer. So you should not be burning your mask. It gives a very awful smell when the mask starts getting burnt. So can we use the UV lamps that is used in the tanning beds? This is one patient had asked me, she ran a beauty parlor, whether the tanning, for tanning nail beds, the nails and doing a manicure or a pedicure, the same UV lamp can be used. That usually gives the UVA or UVB radiation, which is unsuitable. You require UVC of 254 nanometer wavelength, and tanning lamps cannot be used. Can I put my N95 FFR in the sun? It would be ideal. You use the mask. We have plenty of sun in our country. Right now we have the rainy season. Otherwise, we have plenty of sun in our country. You use a UV and hang it to dry from your clothesline, but it does not work. It does not give you a sufficient amount of UVC, and it will not neutralize the pathogens on the surface of your mask. So the key consideration that hospitals should look at when implementing UVC decontamination is that they should have a designated area, a designated personnel, appropriate protection should be worn, and the mask fit user seal check should definitely be carried out. The mask should be physically examined before it is donned. Now let us look at heat in decontaminating. The heat that is used is wet heat with humidity, 70 to 85 degrees centigrade with 50 to 85% humidity. And if there are relevant studies on this, this would be an ideal method in hospitals to decontaminate the mask. We can use the warming cabinets, water baths, autoclave, or the oven, which we already have in the hospital. The mask can stand up to 30 minutes heating cycles at 60 degrees centigrade and 85% relative humidity. So this is a method that you should look into. We're eagerly awaiting literature on this. And when this method is validated, most of the us can use it in our own hospital. This is the CDC guidelines on use of heat plus humidity in decontaminating. Dry heat is not very useful, or heating the mask in the microwave oven is also not very useful. In the microwave oven, the mask can get burnt. In addition to that, the metal component of the mask, especially the nose piece, can cause arcing inside the microwave oven, and the elastic strap also gets damaged. So when you're using wet heat, the hospital should look at the correct temperature and humidity, and that, as I've already said, would be the ideal support. Ozone is another way of decontaminating that is being looked at. Not much literature is available. However, ozone is a gaseous compound. It often has use for odor elimination, water purification, and agricultural products, especially bacteria. Its effect on virus is not known. On its effect on the SARS-CoV-2 virus responsible for the COVID-19 pandemic is also not known. So how does ozone act? Very limited data is available on this very strong oxidizing agent, which acts aggressively with any organic matter and destroys it. The rubber, especially the strap of the FFR, would get damaged if ozone is used. This is another method that is coming up. It has been, FDA approval is not yet obtained for it, the Aptar Active Shield, which is actually strips impregnated with chlorine dioxide. The disadvantage is that the process takes only 3 hours. You can put your mask in a plastic, any plastic container, put the strip along with your mask, and then in 3 hours time, your mask is decontaminated. However, the chlorine residue and the smell of chlorine will be there in the mask, and what harm it does to our respiratory passages, and how safe and effective this decontamination procedure is not really known. Can the healthcare worker take his mask home and decontaminate it in his pressure cooker, in his dishwasher, food dehydrator, etc.? No, you should not take your mask home or use household appliances to decontaminate it. Is there any validation that any of these decontamination methods is effective on SARS-CoV-2? There is very little scientific research on this new virus. Most of the research is on influenza virus, which we have to make do and extrapolate the findings for SARS-CoV-2, since both the virons are of almost similar particle size. So a caution, so whatever decontamination strategy your hospital follows, you see to it that the procedure is validated and have it approved by your ethics committee. These are some posters which you can use in the hospital. We got it from the Hong Kong University site. Is it possible to protect yourself with towels? This is for the general public. You can protect others by covering your nose and mouth. Can you sanitize your mask by using an alcohol spray on it? No, you cannot sanitize it. It destroys the filtering capacity. Is double masking useful? Actually, it interferes with the filtration capacity. More than the filtering capacity, it interferes with the fit of the mask, and you cannot breathe properly. And after some time, you will pull it down your nose. Do-it-yourself mask is something is better than nothing. And these are the size of the percentage of particle filtrate efficiency of various material and household material, out of which the best is the vacuum cleaner bag and carbon impregnated material. And this is for the men in KSOS. If you are having a very stylish beard, it is better to be clean shaven when you're using the N95 for better fit. And let us look briefly at the mask movement in India, the Indian initiative. These are some of the vendors that I contacted when I looked at a mask for my own institution. And these are the prices ranging from 130 for an N95 to 270 rupees. Some claims that they are near certified, but when you actually look at the mask and look at how to identify the counterfeit, if they are not identified. This is a very good initiative which has come up. Parishodhana agency, actually the Remedio, which has done wonderful work with the phone photography, the smartphone photography, as well as the ROP screening. They have come up with this N95 disposable mask. They claim that it is 10 layered. It actually each ply has 5 layers. It has 2 layers of meltblown and the others is spun, and they have got the Citra certified. It is Citra certified. And they claim that it has an efficiency which is superior to N95. It filters, the particle filtering efficiency is 97%. So it should fall somewhere between N95 and N99. Then we have this mask. I saw Rajiv Sukumaran's photo with this mask on the Kavach, which is again ASTM certified, and it has a particle filtering efficiency of 0.3 microns of about 90%. If you look at the global market, if you're planning to go into mask, we had a part-time person coming in to do our tally entries for us in the account section, and suddenly he turned into a mask man. He dealt with all kinds of masks. You had to just ask him, he'd give you any information on the mask. That this is how the global market on mask is, from a meager 1 million global pricing for the mask. It has gone up by about 10.1% to 360 million. And it is supposed to go high. So if you want to invest in mask business, this is the right time. And there are a lot of Indian initiative. Now there are about 20 companies which has applied for the Citra approval. Maybe down the line, we will get very, very reliable masks. So my final word is discard N95 respirators following use during an aerosol generating procedure. Discard N95 respirators that are contaminated from patient's body fluids or blood. Discard N95 respirator after coming in close contact or exit from an area which is heavily infected. Consider using a cleanable face shield over your N95 respirator. Perform hand hygiene again and again and again. I'm telling the same thing because this is something that has to be emphasized. It is cheap, easily available for us, and we can use it. Extended use alone is unlikely to degrade the respirator. It is how roughly you don and doff that damages your mask. Your healthcare facility and your healthcare workers should have clearly written procedure protocols, and discard any respirator that is obviously damaged. I thank you very much for your kind attention. That is me in the OP. Thank you very much.
Thank you, madam. You deserve a PhD for this, madam, in maskology. Excellent. Now we have a lot of prominent people in the audience. Let me ask Mohan sir to, sir, can you unmute and Mohan sir is not there. Sir, are you there? I don't think he's there. Then we'll go to Shashi sir.
Please mute.
Yeah,
Mohan sir has come. Sir? Can you unmute, sir? Shashi sir, you can go with your
Madam, Madam, that was a wonderful presentation. You have researched it thoroughly, and it has got lots of information. But there are certain practical issues we would like to highlight. There are even you have said that using 2 masks is not a solution. But there are centers where these N95 masks are not available. There are still people who use 2 3-ply masks. Is it acceptable saying that something is better than nothing?
Something is better than nothing, but you can make it actually a little more fitting to your face. The first mask should be taped over your nose and under your chin. For example, in our center, when we take up a patient for a procedure, for example, the patient needs an angiogram, OCT, or a IL master has to be done. The first mask is taped on the patient's nose as well as under the chin. And we give them mask in which we can tie, not the one which is looped over the ear. And then they wear a second mask on top of that. So that way, what is there? The filtering capacity is about 80% for the surgical mask and 95% for the mask. You're not dealing with patients with that much viral load. So a surgical mask may be enough for us. But then more than the filtering efficiency, it is the fit seal that is important. So if you're wearing 2 masks, you tape the first mask tightly and then wear the second one on top of that.
There are certain N95 masks which are available in the mask which can be folded on itself. There are some which comes as a cup, some which comes which can be folded.
There are various designs. The one can be folded. They have claimed that it is the pocket N95, and it is actually the platypus mask. I
yeah.
have that in the picture. It is shaped like that.
Yeah.
Ideally, it is best not to touch the outer surface of the N95 mask except when you're donning. And that too, when you're donning the mask, you wear your gloves and then only don the mask. There are various shapes. The cup-shaped one actually lasts longer than the platypus foldable type. And when you're buying the N95, see to it that you buy the one with the nose enhancement. Because at the end of the day, using your gloves, you stretch out the nose and enhancement. And next day morning, when you wear it with gloves, using both your fingers, we have the habit of pinching it with a finger. Don't do that. With both your hands, this is how it should be done. Smooth it over your nose so that the fit is tight.
Does it come with different sizes, this N95 mask?
No, mask does not come with different sizes. Now, previously, ideally, you have to do a fit test, find out what shape your face is. What is done in the fit test is the person who is going to wear the N95 mask, his face is put inside a big plastic pouch kind of thing, which has a opening through which the person wears the mask. You put in aerosolized either a sweet substance, saccharin, or a salty bitter substance. And then the person has to say whether he can taste the bitterness or the sweetness on his lip. That is how it is tested. There is no different sizes like XL or double XL, but people with larger faces and people with very small faces, sometimes the mask may not fit properly. And people who have beard, ideally you should shave off your beard. There are certain configurations. If you look at the website, you will know there are only certain configuration of beards that is permissible when you're wearing the N95.
Mohan sir, are you there? Sasranama sir? All of them are online, but not physically there. Is Dr. Chandrasekhar there? He's from Aravind. He's the expert NABH inspector as well as Chandru.
Dr. Rajiv, yes, Doctor.
Do you have
Thank
any
you, madam.
questions?
It was a wonderful chapter on masks, actually. You have covered almost everything in the masks. I just want to add a few points about donning and doffing. So the way they should hold it in their hand, put on the top one first and the second one. While removing, they must remove the bottom strap and then the top strap. We also advise them to bend forward because at the end of the day, the outer part of the mask will be contaminated. So without even touching their dress, they have to remove. So that is one small practical point which will be useful about donning and doffing of either the surgical mask or the N95 mask. Thank you, madam. It was a good talk. Thanks, Dr. Rajiv.
Yeah, welcome. Are there any more questions?
Rajiv, you have tried that nasal catheter after sealing and then all sides of the mask.
Yes, it's very, very helpful.
Yeah, how do you sterilize that nasal cavity, or do you discard it?
Discard it, disposable.
Okay.
It's very useful because patients are usually not used to these masks. You know, when we give, you can feel it yourself. When you're wearing a N95 mask, put in a small catheter through the side and give oxygen, you'll feel so relieved. Exact feeling the patient gets when we put a small catheter underneath the sealed. I put micropore all around, like Madam said, and with the catheter, I connect the oxygen to it. Patient is very, very, very comfortable.
This is during surgery, Rajiv.
During
Yeah,
surgery.
during
Madam.
surgery.
So, Meena, previously when Rajiv called me, I couldn't unmute myself. Now I think I am audible, no?
Yeah,
Yes,
you
sir. Yes,
I am
sir.
audible. So the thing is, though for doctors and healthcare workers, cloth masks are not permissible and it's not ideal. So there are some cloth masks, which are very thick. The usual cloth masks we see are sort of filmy things, very, very, very sort of a large pore size. But some of the cloth masks they now come up with seems to be very thick. Seems to be good. Do you have any idea on that?
So these are usually the 3-layered cloth mask. They actually stitch a cloth pocket, and inside the pocket you can put any filtering material. If you can get a thin filtering material, meltblown is very expensive. If you can get a thin filter material, the ideal filter, I showed you a slide, the household material that can be used for filtering. Banian cloth is actually a good filter. You can use the vacuum bag in a vacuum container, or the RO water plug. Your water filter will have an RO paper. If you can use the RO paper. But the difficulty with all this is that once you put in an efficient filter into a cloth mask, it becomes very difficult to breathe. You can wear it for some time, but when there is carbon dioxide buildup inside, and it will cause headache, and the person becomes irritable, and invariably you have the habit of just pulling down the mask. This is what occurs. There are people who even stitch a pouch. Each mask will match the churidar that they wear. They use the shawl to make the pouch, and then they put a tissue paper inside and wear a mask.
So actually, I wanted to ask you, because now a lot of designer masks, even doctors are wearing designer masks, and so how good it is, I don't know.
It just says that you respect the environment, you respect people around you.
So anyway, it was we didn't know that there is so much of thing in a mask. In such a thing that we see commonly from the housemaid to the HOD medicine, we didn't know that there is this much of content in that. It was very great.
She has
Mohan, sir?
unmasked. She has unmasked.
Mohan, sir,
what
is online, sir.
So actually, actually, they should go to all medical personnel, not only to ophthalmologists, because this is something.
This has become an encyclopedia, sir.
Yes. So they should go to all medical personnel.
It will be there in the YouTube. It will be shared, sir. So, Mohan, sir? Sir, I'm not able to hear you.
So probably he couldn't unmute, probably.
No, he's unmuted, but probably his mic is not working. Padmaja madam is there? Madam? Mohan sir is trying to say something, but it's not audible.
Any questions on YouTube?
No, there's nothing on tube. That's what I was trying to see. Mahesh?
Yeah.
Any question?
Nothing. She has covered. Like
For Mahesh, it's flying above the head.
yeah.
This 2-layer mask, does it have a filter or just a polypropylene sheets?
No, it does not have a filter. That is a procedure mask, sir. The 2-layer mask is a procedure mask that is usually used in casualty. It will have a loop. You just put it on. It is just to protect the patient from your secretions. And after the procedure, you have to discard it. That does not have a filter. And the fabric, the non-woven fabric, can filter up to 3 micron.
Okay, so a cloth mask is better than a two-ply mask?
Cloth mask is better. If you have a 3-layered cloth mask, to a certain extent protection it will be given, but you have to take into account the difficulty in breathing. Now people are coming up with the carbon impregnated mask, the carbon filter, which is actually a very good idea. Instead of 2 layers of melt-blown in the N95, 1 layer is melt-blown and another layer is a carbon filter. Other material are used, like I said, is the RO paper, reverse osmosis paper, or the vacuum bag paper. If we can get that cheaply, then we can make our own mask. It just put 2 layers, which is thin enough for us to breathe. Maybe a time will come. There's a lot of work going on in masks in the Indian scenario itself. There are at least 20 companies who have given different designs of mask in India for CITRA approval. CITRA has a lab of excellence. They are in Coimbatore. They have a lab of excellence in medical textiles. So once it is certified and it gets the BIS, our mask actually equivalent to N95 is the BIS B2 certification, which none of the masks that we are using right now have. We are wearing something thinking it is N95. How much protection it affords us, we don't really know.
Is there any mask with non-woven material which is washable?
Ideally,
cloth masks.
Not cloth mask, non-woven material, non-woven material.
Right now, nothing is available, sir, that can be washed. And washing with soap actually damages the filter. The cloth, the non-woven part is all right, but the filter gets damaged. And what we need is the filter in the mask. Ideal would be to ability to decontaminate the mask in the autoclave, sir. If scientific studies come on that, then that is all of us use the autoclave. So daily N95 mask, not on a theater days, the days can be autoclaved and reused. The UVC one, actually the problem is that you have lot of types of UV lamps available. If you're going to purchase a UV lamp, there is so much variety that is available. Some of them are fluorescent coated. What happens is that when you on the lamp, it releases a lot of ozone, which is actually damages the mask and it is harmful for us. So you have to select the right kind of lamp which should deliver UVC at 254 nanometers, and you should be able to give about 1 millijoule of UV radiation on all surface of the mask. It should cover all surface of the mask, otherwise it's of no use. Making an UV box on their own will cost anywhere between 7,000 to 12,000 rupees only.
Is there any study on ETO for sterilizing the mask?
There are 2 or 3 studies on ETO. The problem, ETO also would have been an ideal thing if something could be done to remove the residue from the mask.
That can be removed by aeration?
Request the very long duration of aeration cycle to decontaminate it. Use the ETO. The duration required for the ETO cycle is 1 hour, and you require a lot of ETO gas concentration, 725 to 833 grams per liter. ETO does not physically harm the mask. The filtration, fit, everything is retained, but you need an extensively long aeration cycle. And you have to also take into account that ETO is carcinogenic and teratogenic. So if you are wearing something that is carcinogenic and teratogenic over your nose, we are going to wear it for long periods of time again. It's not going to end in a month or so. So that is the problem with ETO. Ideal would be to have a strip like the chlorine dioxide if there is some way of removing the residue. You just take your mask, put it in a pouch, a strip of, like how we autoclave, you have the this thing to show that it is sterile. You keep the strip of paper in it. The same way. That would have been ideal. Now using the autoclave.
I have a question. Shobhya. Can I ask a question?
Yes, please.
Ma'am, does UV light actually sterilize the mask completely? Does it remove destroy the viral particles which are, of course it sterilizes surface. Does it sterilize the particles that are lodged inside, like between the layers? I read somewhere that it does not.
There is, depending upon the material, each mask, all the masks are not made of the same material. Some models are made of different material. UV penetration through the material is actually questionable. Other than that, in a cup-shaped mask, there is an amount of shadowing, and strap also causes shadowing. And these areas, the UV light will not injure. So better than that is a hydrogen peroxide mask, which penetrates the layers of the mask. But it is much more expensive than that. Ideally, in the USA, they have the option of mailing their mask to the battle factory where the mask will be sterilized. They can label and mail back to them. The hospital just has to ensure that the mask, a particular person's mask, reaches back to him. That is all. So there is this disadvantage of the UV light in addition to the harm that it can cause the eye and the skin. This problem is definitely there.
Ma'am, also, which of these masks, other than the cloth masks, are biodegradable? I mean, right now, I'm hearing news about the PPEs and all piling up in names and causing an environmental problem. Which of these masks are biodegradable, other than the cloth mask?
India is coming out with biodegradable masks. Other than that, nothing else is biodegradable.
Is it acceptable to burn the mask? You see, in our houses, people are using this 2-ply, 3-ply mask. Is it acceptable to burn it?
In the home situation, they have no other option than burning the mask, because if they are going to dispose it out, say someone else will take the mask, wash it, and wear it. That is going to happen. So it is best for them to burn the mask. In a hospital situation, you can actually give it to image. They will put it in the incinerator and destroy it. In a hospital ground, I don't think it is possible to burn. If there is smoke coming out of the hospital premises, the neighbors will have their arms at hand.
What are the precautions to be taken during FFA? The question, madam.
The patient ideally should be double masked. The patient's first mask should be taped on his nose and, like I said, under his chin or on all sides, and put a second mask on top of that. The IV line you should be assisted by your senior most sister who is most proficient in taking an IV line, or you should take it on your own. And during the procedure, you should see to it that the patient is calm and does not retch. There is a way of preventing the patient from retching, which is to ask the patient to open his mouth and take deep breath without closing his mouth till his throat becomes dry, and he becomes more worried about his dry throat than the discomfort in his stomach and the retching. So as far as possible, the patient should such a patient avoid doing an FFA. FFA now is very, I should say, at once upon a time, FFA ruled the roast as the most important procedure in any retina practice. But right now, we hardly do any FFAs. We do an OCT, and in centers where OCT angiogram octa is available, that is done. The role of FFA has become very minuscule in practice. But if you still have to do an FFA, then these are the precautions that are taken.
What is the recommendation for cleaning of face shield?
Ideal is to wash it with soap and water, dry it, and reuse it the next day. If you're lazy to wash it, at least clean it with your 70% alcohol rub.
The problem is that if you wipe the shield, the clarity goes down.
It is best to wash it with soap and water, hang it out to dry at the end of the day. The UV can be used for your pen. UV can be used for the cash that you collect in the counters. All that you can have in UV box. For the POS machine that you have, all that you can use in UV box, or even a formalin chamber would be.
But does it have any validation?
No, sir. There is no scientific validation. Unless something like that, I think it's better for us to tell it in public. We may do it in our own center, at least to assert our own conscience, but to tell in public that this can be done is, I don't think, the right attitude.
Do you insist on non-valved N95 to be used by the staff inside OT?
Valve N95 should not be used, sir. It should be used only by a person.
Non-valved, man. Non-valved.
The non-valved is what should be used. In the OT, all our OT staff, the OT staff who assist the doctor and the anesthetist in my center wears the N95. The other circulating staff just wears 2 surgical masks. The first one is taped and the second one is on top of that. They don't wear the...
Madam, very interesting question. How to drink water in between OP if you are wearing N95 mask?
You ideally should not drink. Before you enter the OP, you have to use the restroom and drink plenty of water and continue wearing your N95 as long as you can wear it. But you do have to take a break for your lunch. So in the morning session, you wear one N95, keep it in a storage box. Afternoon session, you wear another N95. Evening, you keep it in the storage box. So every day you need 2 masks. And at least for 5 wears, we rewear the same thing.
And what about a cloth mask and a 3-layer mask over it? Andrew sir is asking.
It actually protects the environment. It protects your patient from your own secretion. It protects the environment. And wearing a cloth mask in summer, wearing a cloth mask, you sweat a lot under your N95 mask. So if you wear a cloth mask underneath any mask, it will absorb all the sweat and make you feel a little more comfortable. But the filtration efficiency is not there. And in a situation where we are not dealing with infected patients, we are not frontline workers, we are just in the background, and we don't take in any COVID positive patients for a procedure, send them to the COVID designated hospital. In such a situation, if you don't have that much contact with the patient, for example, as a retinal surgeon, I have to have a lot of close contact with the patient. When direct ophthalmoscopy, everything's contact is definitely there. And in such a situation, I would prefer to use the N95 mask. Myself, the staff who assist me, and my optometrist wear the N95.
One sir is trying to say something, but it's not at all audible.
Yeah.
And
now, I mean,
One sir, can you say?
Can you hear me?
Hear us?
Yeah, sure, sir.
Welcome,
Yes,
sir.
Welcome, sir.
Yes, sir. At last we heard you, sir.
Morning. Meena,
Morning, sir.
very exhaustive, very nice talk. A lot of informations and lot of my queries were answered only. And I think the seal test after wearing N95 is very important. That is when the reusing of the mask comes. I think the seal test is very important. When you give a inhalation, when you exhale also, the pressure inside the mask should be okay. There should not be any leakage. And Meena, you have been telling that you wear a cloth mask and over that 95, doesn't it interfere with the seal?
I don't wear, sir. I don't wear. I'm telling. I have seen people wear like that. My only explanation was that it took care of the sweat around the noses and around the mouth, but it did little to improve the filtration.
Okay, the other thing is that the our 3-ply surgical mask, the main problem is with the from any side the aerosols can enter into the mask. That is why N95 is preferred over the surgical mask, isn't it?
Yes, sir. Unless you tape
only
it on all sides, sir. You have to tape on
I-
at least on the top. And here you can ensure that if you tie it tightly, it fits.
The problem is most of us tie the lower tag below the ears. But then if you can take it over your head and tie it there, that is the actual position of the 3-ply mask.
When wearing the N95, the upper thread should be here.
Yep.
At the top of your occiput.
Yep.
And the second one, again, if the strap becomes loose, again has to go above your ear only.
Those are the things that we'll have to sort of choose.
Madam, I made a small video on donning and doffing of mask, which I'll share YouTube, madam.
Yes, sir.
There is one question: can plasma sterilization be done for N95 mask? Yes.
Yes, it can be done.
It can be done.
And
You know what? I am wearing an N95 mask and I sneeze into the mask.
Sir.
Do I change the mask?
No. You don't change.
No, this is the small.
Your work shift.
Yeah, that's right.
Can it be reused, madam?
Yes, it can be reused, but don't touch the inner surface of the mask. And don't let the strap touch the outer surface of the mask. So the mask, handling the mask, you have to handle it more delicately than you handle your baby.
Yeah, that is the most important thing in having a mask. Even the 3-ply mask, I think you shouldn't adjust the mask and then you shouldn't touch the outer surface of the mask, and you should not dangle it on your nose should not be outside the mask, and you should not dangle it onto your neck. And I don't know how many of them go according to all these instructions. Occasionally you see most of the nose is outside. Or when you drink tea, it will be a dangling here, like, you know. You are supposed to change the mask.
Angle, sir. You can take out the mask and hang it if you're in a safe place. Hang the mask.
Exactly.
And have your tea or coffee, and then wear gloves and then rewear the mask. When you're rewearing the mask, again look for the user seal check. The fit
Yeah,
test.
repeatedly inform the hand disinfection before and after wearing the mask. Very important.
Yes.
That is an absolute important point.
It's actually more important than the mask itself.
Exactly. Okay, great time. Thank you.
Sir.
Thank you very much.
Thank you, sir.
Thank you, Rajiv.
Thank you, sir. Madam, thank you for your extensive research and foolproof talk. A comment from one of the viewers. Are there any more questions?
Fine. Thank you, madam.
Thank you.
Okay. Mahesh, are you around?
Yeah.
The concluding remarks, and we'll wind up this program.
Thank you very much, madam. It was a fantastic talk. Actually, everything covered on N95. It will be available in YouTube for future reference. Probably the other specialties can also use that. Thank you very much, madam.
Okay,
thank you, madam. Thank you, everybody, for participating.
Take care.
Thank you, madam. We'll come up with a new topic next week.
Thank you. Thank you very much.
Thank you, madam.